Hi, my name is Ilya Zlotnik, advisor and partner with Vivaldi Capital Management, and your host to Journeys to the Summit. Today's guest is Sam Bendix. Sam is a partner at Chicago Pacific Founders, a leading healthcare-oriented private equity and real estate group. Sam, it's wonderful to have you here.
Thanks for having me.
Absolutely. Well, you and I have a lot in common. We both have a passion and love for business and entrepreneurship, and also enjoy climbing. You and I have climbed at the gym several times over the past couple of years. Initially, we met through our kids. They both go to the same school. We live in the same neighborhood. And today, I really want to highlight your journey, which is unique. You started off differently than most. Training to be a chef in culinary school. I think out of high school.
In high school, yeah.
In high school.
Yep.
As well as hospitality, and then eventually transitioned to business, real estate, and entrepreneurship, where you've had a successful career, which we'll talk about. And one thing that I want to highlight for myself, because I enjoyed the topic, and for my clients, who a lot of them are entrepreneurs and business owners and folks that watch the show, many of them have sold businesses, and many of them seemingly will eventually sell businesses, is kind of your unique perspective of being an investor as well as an acquirer of businesses, but also being an owner-operator and the insight that lends you. But let's start off from the beginning, when you initially decided to go to culinary school.
Yeah, so my career path was unique. So when I was in high school, and I had a wonderful childhood growing up. My parents were incredibly nice, wonderful to me. It's the third child, so I had it easier than my two older siblings. But the food at home was terrible. My parents were not great cooks. And so when I was a kid, I remember growing up and chicken being as hard as a piece of wood. And so I was like, food's got to be better than this. So I started cooking on my own. And sure enough, I thought what I was cooking was pretty good. And when I was in high school, I asked a friend of mine who took a cooking class. I was like, hey, where'd you learn to cook? And he said, oh, you go to this place in the town I grew up in. And I said, oh, do you think I can get, an education there? He's like, sure. So I, not realizing that this place does cooking classes, and that's probably what he was referring to, I just show up unannounced one day, and I go up to these chefs and I say, I want to learn to cook. And they're like, who are you? What are you doing here? And so I tell them my story and how I want to learn to cook. And they said, look, we will have you sweep the floors, do the dishes, and cut onions. I remember cutting just barrels and barrels of onions. And if you can do that, we'll kind of we'll reassess the situation. So after high school, that's what I did. And so my path wasn't going to culinary school. It was being kind of, I'd say, classically trained in two senses. One is, outside of culinary school, the way that you get trained as a chef is by, having a mentor and having somebody kind of oversee you in your culinary experience. And then the second is classically trained in French method and technique. I really lucked out. The chef that trained me worked at Kendall Culinary School, was a executive chef and a sous chef at some really high-end restaurants in Chicago and around the world. And he just was a job for him as kind of in a more easygoing environment, because it was cooking classes and demonstrations and catering events. And so it was pretty easy for him, but it gave me an opportunity to work under somebody who was really accomplished. And I remember the first day, my hands were covered in blood, just from not even holding the knife right.
Oh, wow.
And it was just, and of course, when you're cutting onions, you're tearing up. And so they're like, is everything okay? I was like, no, I'm fine. And I eventually persisted, and, 3 months into it, they're like, okay, we're going to actually teach you how to cook. And so I learned French method and technique. And after that experience, I was like, I want to do this professionally. I want to be an owner of a restaurant. I want to create the menu, want to do everything. Where's a great place to do that? And the chef that I trained with said, go to Cornell School for Hotel Administration. So I applied, thankfully got in. And when I was there, I kind of came to the conclusion that I still love cooking, and I would go back home, when I had time, because I had internships when I was in college. But when I was at home, I would go back to work effectively at this place. And the chef once sat me down and he said, look, you can cook throughout your entire life. And I do cook, occasionally when I can at home. He's like, but if you're passionate about something else, lean into that. And at the hotel school, I discovered I was much nerdier than I thought I was. I really loved math and finance. I was a stats TA and econ TA, and I really leaned into that. Got an internship at a hedge fund and then an internship at William Blair, and then eventually a job offer there, and got my career started in finance from there.
Okay. So what out of curiosity, what's your favorite dish to cook?
I make a really good bolognese, like a phenomenal bolognese. The chef that trained me said, look, like you can, if you're gonna do one dish really, really well,
Okay.
and like lean into that. And that was the dish that I happen to lean into. And so like my kids love it. I don't cook as many adventurous things now because
Okay.
my kids are just like,
Because they're kids.
yeah,
Man, I know.
yeah, I know. They don't make paella anymore or anything like that. But whatever I do make for them, I make it extremely well.
God, my kids like chicken nuggets and fries.
Yeah.
And steak a little bit. So just one quick question before we get into business. If you decided to pursue the path of being a chef, where do you think you'd be right now?
Be in a restaurant. I think actually one of the things that turned me off about cooking professionally was like the obsessive behavior I would have to have about perfecting these dishes and doing the same thing over and over and over again. And to me, it started feeling repetitive
Yeah.
without feeling creative. Whereas in finance, I felt that I actually could be creative, but also it challenged me intellectually in a way that cooking didn't. But what I do like about cooking outside of the restaurant environment is I can challenge myself with different dishes and different cuisine. But in a restaurant, you really have to stay narrowly focused and execute really, really well on one particular menu, one particular evening. Whereas I don't have those constraints outside of the, professional kitchen.
Yeah. Well, one thing that stands out about you to me is that we get together at lunch or we'll go climbing, and you always have ideas. You are very creative, obviously, with the different business ventures that you're looking at with CPF or some of the real estate stuff that you're doing. So where do you think that kind of from, and what's some of the kind of the initial things when you transition into your career, the business world, that help build that base to give you the ability to be creative and do what you're doing now?
Yeah, I think it's two. One, I was very lucky growing up at home. My parents are completely different people. My mom is an artist. My dad is or was a bankruptcy attorney. He's since retired.
Okay.
So having that kind of dual influence was great. My mom was all about thinking about things differently, seeing the world differently, observing things differently. My dad had a very analytical approach to life, and I got exposure to both those things. Like I took classes at the Art Institute, but I was also in speech and debate, and that really helped me as far as inform my life of being like, hey, it's okay to learn the basics, but also be creative and see if you can, think outside the box. So that's kind of the way I approach finance, both within work, but then also outside of work too. I love CPF, the firm I'm at, because they have this mindset of healthcare is actually a huge landscape in which you can invest, but there's ways to be creative as far as how you can create value with your portfolio companies, and add value to the groups you're partnering with. And then outside of work, my view on why it makes sense to invest privately is I think it actually makes me better at my day job. One of my main focuses is raising capital, and I think it's easier for investors to talk to somebody who's also an investor in private, real assets as well. I think it confers a lot more trust, and you get the sense of like, I understand the perspective that they're thinking about when they're thinking of what are the questions they're going to ask CPF, why are they asking those questions, what is it that we can deliver to them as an investment manager to make their portfolio more robust or deliver the returns that they're looking for. So I think that mindset is super important.
Well, then let's dig a little bit more into CPF. The thing that stands out when we talk that makes CPF different is that it both focuses on the private equity side in healthcare, but also on the real estate side, and kind of marries the two. So talk a little bit more about that and the kind of the edge that offers you as investors.
Yeah, so I think what really drew me to CPF, I'll start more holistically, was that the firm was founded by people that had started their own companies or were executives at companies, took them to sale. And so they really saw from the perspective of an entrepreneur, how is it that I'm building a business? And one of our founders, Mary Tolan, she got this kind of bird's eye view of the healthcare landscape. And she realized that there was so much opportunity to make the healthcare system better. Bend the cost curve, as we would like to say, try to deliver better healthcare more accessibly, and create like a really good system for patients to be able to get the care that they need quickly, cost affordably. And so having that mindset, then going into the investments, and looking at these operating platforms and understanding, well, what are the founders trying to do? Are they aligned with our vision and mission? That's really important. But the other kind of angle of this, to get to your question about, why private equity and why real estate is, well, why does this whole healthcare landscape make sense in general? Well, there's a huge underlying current, which is the demographics in the United States. There's a gigantic population that's aging into the baby boomer segment, where these baby boomers are now consuming more healthcare services. And as a result, there's more of a pressing need to make the healthcare system more efficient. That same need also applies to real estate as well. Why is that? Well, in medical office, for example, you can deliver the same healthcare or better healthcare than maybe a larger health system can, because you can be more nimble. You can go to the suburbs of an area, provide cardiovascular, dermatology, whatever the services are, and make it more accessible to the patient, provide it in a more cost-effective setting. And that tenant's really sticky. So it's a great investment from the perspective of the landlord. I want that medical office user, because they're building this entire business around a patient population. They're also investing a lot of money into the space. And they're maybe taking a vacant office or a vacant retail center and revitalizing it, making it more attractive from a real estate perspective.
I would also think they're fairly recession-proof too.
That's right. Yeah.
Yeah.
That consumption pattern happens regardless of, the economy. People can't help but consume those services.
Yes.
What's interesting also is that there's also a housing need as well, and senior housing, which is another area we invest. There's a tremendous need for properties that can take care of elderly residents, because there's a decline in the amount of adult children, but also just in-home caregivers that can look after these particular residents. And so they can have a sense of community, but also a sense of safety. They can also get a lot of the life burdens taken off their plate, so they don't have to worry about repairing the roof, mowing their lawn, getting healthcare services delivered to them, or having somebody take you to the hospital, making sure that nurses are actually looking after you on a 24/7 basis. But I think what's even more interesting about CPF's business is they didn't stop there. They took a much more private equity mindset to investing in senior housing. They actually bought their own senior housing operating platform, which they did in 2014, 2015, and that was very unique, because when I was in the sector in that time, the whole mentality was allocate to a lot of different operators, which a lot of groups still do. But why CPF did that was they wanted control over that particular real estate's business. From a private equity mindset, why would you buy an asset like that and then effectively outsource the operations, which is critical to driving value, to some other group that didn't have that same alignment?
Yeah.
So I really love that mentality as well. And they've been able to drive, phenomenal outcomes from a portfolio perspective as a result.
Yeah, it sounds like effectively you're trying to vertically integrate yourself across a lot of the different value chains and the real estate when it comes to healthcare. Yeah, I mean, I find that healthcare, especially when it comes to insurance, to be enormously complicated. And that's for myself. And I'm healthy. I don't go to the doctor very often. I'm pretty proactive about my health. I can't imagine how difficult that must be when you get older. And we help clients get set up on Medicare and all that kind of stuff as well.
Yeah, that's really important. That's kind of one of our missions, is trying to make the healthcare system more accessible, especially to the senior population, where people may just find accessing healthcare in general to be super confusing, or just inaccessible from the perspective of, I can't even schedule an appointment with a mental health provider or a primary care physician. And the problem with that is any underlying health issue can escalate over time, and then eventually they do need to see this mental health provider because they're having a psychotic episode, and that can be prevented with early, prevention of seeing that provider early on in the life cycle of the patient. So we really focus on making sure the patient can get access to the care quickly and, again, cost affordably.
Yeah, I'm glad to hear that, because I feel like historically the way the healthcare system has been set up is more like sick care and reactive.
Yes.
People wait for somebody to get sick, and then it's just the amount of money you spend on helping somebody recover or prolonging their life versus just trying to fix the issue at the root. So it sounds like that's a problem that you're trying to tackle.
Yeah, you encapsulate the problem very well. And I think also it's an overutilization. You know, you keep trying your best to try to get that healthcare, and eventually you're so sick that you have to use these really expensive components of the healthcare system, like the emergency room.
Yeah.
Are there ways of keeping that patient out of the emergency room with better primary care? Those are some of the things we're trying to address in our portfolio.
Yeah, there definitely is. So let's talk a little bit about the one thing that I mentioned earlier which is the fact that you're both an investor, an acquirer of businesses, both with CPF and then some of the real estate stuff that you're doing on the side, which is interesting. Feel free to talk about what you're doing there, but also as an owner operator, right? Like because a lot of my clients are entrepreneurs and business owners, some of them have sold businesses, others are thinking about selling businesses. From their perspective, if they're thinking about selling their business, what are some of the key components or strategies they should be thinking about to make shifts to make themselves a better company to acquire?
Yeah, I think there's some things that people are going to want to think about in the first maybe even 90 days, even before they engage an investment banker. I would say that there's a couple of things, and I can dig into these points. One is, am I ready to sell my business? The second is, are my key contracts and relationships in order? The third, I would say, is pain points that I've identified as I've built up and operated my business. And the fourth is, what does the future look like for the business, for myself? So on the first point, it is very difficult for us or maybe a strategic buyer in like the healthcare universe, say an insurance plan or a large health system, or us as a financial buyer, it's a private equity firm, working with an entrepreneur, and then 3 months into a process, they just decide, I don't want to do this. And it could be for a variety of reasons. And then it's much harder, say, years later to then re-engage with that individual and feel like I can trust that this process is going to see itself through. And what I think it can also be difficult for the investment banker as well. So it's really important for that entrepreneur to say, not only am I prepared to do this, but why am I doing it? And figure out if this is the right decision in their life to do it. But it doesn't mean as soon as you sell to private equity or strategic, like your business is gone from you. It just means that the partnership is changing, but it is still a partnership or should be a partner that you're bringing into your business, not an adversary, not somebody that's taking control and taking a completely different direction away from you. So those mentalities and mind shifts are super important to have.
On that note, what I see in that process when I'm talking to my clients who have built very successful businesses, effectively their baby, some of them it's their life work, is they're thinking about, well, when I sell, do I stay on?
Right.
Do I want to get out? Some of them are burnt out. If I stay on, what kind of control am I going to lose? Because these are people that have never taken orders from anybody else effectively. That's why they're entrepreneurs. They're afraid that if somebody to buy them, they're no longer going to be the boss. And I see them oscillate between the two. To your point of like, are you really ready to sell that business? Sometimes I'll talk to somebody and they'll be like, I'm ready to sell. And the next day they're like, not yet. So kind of to your point about really knowing what you want to do.
Yeah, and I think for us, we're in a unique situation because we're always, or most often the case, the first private equity or institutional capital into a business. So it's a very similar dynamic to what you're describing. It's with an entrepreneur that's built this business. And one of the things that I learned about when I was working in CPF is our pitch to investors is so similar to the pitch to the entrepreneurs who are buying their business. And there's a lot of comfort knowing that the people you're sitting across the table from, our founders, have built their own businesses and run them and then sold them. So they know exactly what that entrepreneur is going through. And they can give a lot of comfort as, hey, this is what the process looks like. This is what the future can look like. Here's some case studies from what we've done before and what I've done with my own business. And I think they really like to hear that. I would say that the other things they need to examine are as basic as like the finances. Like you don't want to be spending time with your investment banker getting your finances in order. If you're going to go through that decision, try to do as much work ahead of time. This is just some of the basics, like making sure your leases are in good order. You're not entering into any long-term contracts that may obligate you for a large spend. Try to test into some maybe new phases, new businesses or business segments that you feel like, hey, this could be a good path forward on growth, but don't feel like you're locking yourself into something that's brand new that could disrupt what you're effectively selling, the larger business. And then pain points. Maybe there's something that you felt like, hey, I just couldn't grow into this new market because I didn't have these sets of relationships. I didn't know these payers. in these new markets, or I would love to be able to buy this business, but I don't have the capabilities of buying a business and then integrate it into my own. So I think those are the pain points that you want to figure out ahead of time, because you want that partner to bring something, and it's not just capital, it's also a way of growing your business strategically to allow you to hopefully focus on the things you do enjoy if you're going to stay with the business. And the things that you do enjoy should be getting those pain points off your plate.
Yeah.
And then I'd say the final step, that fourth step that I mentioned, is the growth of the firm. So, painting that picture about what the future looks like, it's great for yourself. I think it'll also, as the entrepreneur, give you comfort of, okay, this is the next step I want for this business. And it makes sense to bring in a partner to help me get there. And then you can convey that message to the investment bank. You can convey that message to your next buyer. And also, if that next buyer isn't on board with your vision, it may not be a good fit, but they could also, and this is where being open-minded is so important, it may say, I like your idea, but here's one that you should consider as well, and maybe it's a better idea. Sometimes in these kind of fret negotiations, people have these, blinders on as far as where they think the future could go. But I always feel like, and this gets back to this idea of like thinking outside the box and being creativity, I want to make sure that I'm hearing all these different options. And I think having that mindset as an entrepreneur is super important too.
Yeah. I mean, there's definitely a lot of benefits to having that type of partnership. Clearly, you get access to a lot of smart people that have seen the whole process.
Yep.
And then also the relationships, the capital, all that. How do you guys look at an entrepreneur who wants to take his chips off the table and move on versus somebody that wants to stick around and help you grow the business?
Well, I think that in either case, we want to make sure that entrepreneur has built a business that is around the patient and patient-centered. Mm-hmm. We do have a tech business, so that's a little bit different as far as the mentality of the founder. But I would say that in our value-based care verticals and our roll-up strategies of the kind of dermatology, whatever, we want to make sure that founder has built a business that's centered around the patient. Mm-hmm. And if they think that they can't continue or don't feel like they want to continue to deliver that personally, then that's fine. We can't or don't want to force anybody to stick around. I think what's going to be important in that situation is just agreeing on what the transition looks like and making sure that's really smooth. If they do want to stick around, then you have to figure out, all right, in what capacity? Do they want to take a leadership role? Do they want to offload maybe the responsibilities of, the CFO? Do they want to bring on somebody that helps with kind of compliance from a healthcare perspective, making sure that, billing practices are in order, that there's governance that's set up? And if they are in a leadership role, and governance is so important about what we're doing as, a private equity firm in our investments, that they are okay with how decisions would be made going forward. And often the case, we're looking to make them more streamlined, not bureaucratic, because we want people that are making decisions quickly, that are based on evidence, and that are moving quickly towards a goal that we're setting out. And not to go on a tangent here, but we look at a segment that's maybe highly fragmented, like oral surgery is an area that we're really excited about, and there's call it 9,000 to 10,000 providers. The vast majority of those groups are smaller, but maybe you could pick one out and build a business around it. But if you pick the wrong one because the founder isn't aligned, and maybe the decision they should have come to is, I do want to eventually leave the business. Mm-hmm. It would not be conducive to you as the buyer for that person to stick around, right?
Yeah.
I think often though, most founders, want to stay in the business.
At least for a period of time to transition it.
Exactly.
And they care about their employees and their patients.
Exactly.
Yeah.
Exactly. And I think that's important too, to make sure that cultural alignment is still there as well.
Got it. Okay. Yeah, that makes sense. And then what's the vision that you paint to a founder that wants to stick around? Because effectively you're a private equity fund. These investments get placed into a fund that has a definitive life. Typically, yep. I don't know how long the life of your funds are, but what's the vision you talk about the eventual exits and that impact down the road?
Yeah, the way that we lay that vision out is like the very first conversations when we're talking about, here's what your business looks like. Here are the similar businesses we've invested in. This is the to from, we like to say. So this is where they were, this is where we got them to, and how quickly we did it.
Yeah.
And this is why it's so important to partner up with the right founder, because if you don't, that vision can take twice as long. And if your multiple is the same at the end, your IRR is going to be lower, right, than if you didn't have the time. And we're all about making sure that we're delivering value, quickly and efficiently, like all groups are. But we want to make sure that, say that founder is great, is a great provider, built out a business, but maybe does not have the experience or the network to get new payer relationships. We can bring that on board. Maybe they want to expand rapidly, but they've never taken in an additional investment, bought a add-on. For us, we can drop in our business development team. One of the things that's unique to us is because we're focused on healthcare, we have these extensive networks built within the healthcare ecosystem. We even have a talent team that's dedicated to helping us find the right folks. And that's great for a variety of reasons. But one of the biggest is they're just focused on the healthcare industry. So they have this vast and deep network of executives they can place in these businesses to say, all right, this was the pain point that you wanted to solve for. Well, here's the individual that can help you solve for it. This is their resume. And they didn't need to be a part of a process where they were interviewing hundreds of candidates. They got the best, top quality candidates, the narrowest part of the funnel, and they can spend their time just talking to those folks. It's all about how can we help them scale up not only their business, but also their time as the entrepreneur.
Yeah, focus on the most valuable and for them maybe the most enjoyable things of their day.
Exactly. Yeah. And I also think it's so helpful for them to say, okay, like now I have a group coming in and they're putting in systems in place so I can capture KPIs with regards to patient care, or how the patient is thinking about the overall process, or the providers are thinking about the overall process of care, and seeing those metrics. It may be the first time that they see those metrics, and it's really eye-opening for them. But that's part of the value that we want to bring, and then we can say now we can align our goals to those metrics as well.
Yeah, I can also see with the right types of entrepreneurs and that are looking to sell, and a lot of entrepreneurs are wired very similarly. They tend to be A personalities, very competitive. And if there's eventual exit, like a second exit, there's metrics that they need to hit to get that, people love to say, the second bite of the apple.
Right.
Right? I always hear that term.
Yeah, we want to make sure that when the group or individuals, it can be a group of physicians or the individual that built the business, is getting that additional distribution, they feel like they actually created more value with us as a partner than, say, going with some other group that has healthcare as a focus amongst many different verticals.
Yeah.
But the value that we created, we did it quickly. We did it also with the patient in mind. That's super important. We've partnered with groups before in the past where, and we always like to say this is the case, where they were just obsessed with the patient outcomes. They wanted to make sure that they were doing skin screenings to catch potential cancerous issues from a dermatology perspective, and then address those immediately. They never wanted a patient to walk out of the clinic that could have had skin cancer that they could have caught. And we're like, okay, great. Let's figure out a way that we can do that with every patient to ensure that you're being able to deliver that outcome, but also get the financial outcomes you're looking for as well.
Okay. Well, let's talk a little bit about technology and AI, which is maybe the most talked about topic nowadays, which rightfully so, only from an investment perspective, but also just, I think about my own business and how I'm using ChatGPT and just all the functionality there and Copilot and all that kind of stuff. So how are you using it now? How has it changed your business, both as investors and operators? And then where do you see the future of it?
Yeah, I can talk about it, maybe my own personal philosophy around using it, but then also how we think about it from a business perspective. From a business perspective, especially in healthcare, I think people are super excited about like AI doctors and AI nurses. I don't think we're there yet. And we would encourage people to
AI companions for the elderly?
and AI companions for,
I think they have those, don't they? Like dogs or something?
Yeah, exactly. Yeah, like every kind of iteration of let's figure out how we can replace a person, right?
Yeah, right.
And I don't think that's actually the right mentality, because the healthcare system is just full of these different friction points.
Yeah.
I didn't get my bills done on time, or my notes are, jumbled, or whatever it is. But it's not about my interaction with a person. It's my interaction with a process that's very bureaucratic, that's inefficient. And that's where AI can come in and say, all right, we can streamline pre-authorizations. We can make billing and revenue cycle management more efficient. We can help you with your note taking. Those are tools that are helpful for those providers. And why is that important? Because it allows a provider, and this gets to the kind of first point I was talking about, our mission and vision is like, how can I get the provider to be with the patient more, right? If the provider is burnt out because that individual just has to spend all this time with documentation, and like you probably had this experience, I know I have. You walk into the room, you've been sitting on a bench for like 45 minutes, the provider comes in, their back is turned to you the entire time, right? For the whole 5 minutes you're seeing this individual, and they're just taking notes. And they like turn to you and they're like, oh, there's a person sitting there.
Yeah.
Right? And then that's your experience as a patient. And it's really underwhelming, right? And so if you can use AI to supplement aspects of that process and make it more efficient, I think it's probably the most exciting part of the healthcare system. We organized a panel with some AI experts at our AGM, and their recommendation was very similar. They're like, we're not at the point where AI can supplement, having interactions with a provider that's delivering critical care to a patient. It is everywhere else along the value chain that you'll see it. And then, personally, it was funny when I was in college, I remember we had this like basics of computer class, and all the kids are groaning and rolling their eyes, just thinking like, this is going to be a waste of time. Like, I know how to like open up my like, word processing file or Excel or whatever. And the teachers are like, time and time again, when these kids leave, they say this is the most valuable class they ever took in the hotel school. And especially going into banking, super valuable class. And I always thought to myself, at what point am I going to really sit down and re-educate myself proactively on something? And I read a lot of nonfiction books on business. But when AI came along, I was like, okay, like I clearly have to lean into this, right? Like this is going to be the thing that I really need to focus on. And that's where I spent a lot of time educating myself. Like, what are the processes that I can make more efficient, like personally, professionally? And that's what I've used AI for, is how can I streamline my business, reduce my own friction points.
Yeah.
So organizing my thoughts, prepping for a negotiation, working with my home insurance, right?
Prepping for this interview.
Yeah. Oh yeah. I mean, I had my, voice AI, and we talked through questions.
Yeah.
So
That's pretty cool.
yeah, absolutely. And it gave me feedback.
Okay.
Said, do a better job promoting AI.
Actually, I have a few thoughts on all of these things. One of the things that's the wildest is one of my partners at Vivaldi recently sent me an interview, and I listened to it, and I'm like, this is pretty good. And he's like, that was all AI generated. Like just two voices. He fed in a deck and prompted it with two different people to talk about that deck, and I had no idea it was AI generated. That's number one. So that's a little scary. And then also, a lot of the stuff you're talking about is low-hanging fruit, like the notes. It's like so easy.
Yeah.
Right? And the fact that a lot of people don't do that still is those are easy things to do. I will share one experience I had recently at a doctor's office. So I'm very much like focused on my health and wellness. I have a good friend who owns a gym and a health and wellness studio and does all the blood work readings and all that kind of stuff. But because of my insurance, I also have like this annual free checkup. And I go to this place, I will not name where I go. And, I see a different doctor every year. I just come in, they say, don't eat anything, you got to fast and stuff so they can do your blood work and check out your insulin and glucose reading. And they do that whole thing. I sit down with her. She asks me the same questions every single year. Do you get good sleep? Are you stressed out? I'm like, yeah, I sleep well. I'm not that stressed. I eat healthy. I exercise almost every day. I don't smoke. I don't really drink. I don't do drugs, all that kind of stuff. And then she does my blood work. I get my results back. No real feedback. And I see my cholesterol is high for the first time in my life.
Wow.
And I reach out to her. I say, why is my cholesterol high? She's like, this is her response. Well, you should either sleep more, get more exercise, have less stress. I'm like, this is horrible. That was my experience with them. But I'll go back because the blood work's free. I actually had my guy review it. But back to AI, the thing that we're focusing on right now is because every business can be really boiled down to different processes, right? Is integrating all that data, which is disparate in different places, is not really flowing completely.
Oh, interesting.
And once you get all the data to flow together and then incorporate all your different processes, That's really where I think the magic happens, and we're so close to that.
Yeah, I think that where AI is missing right now is its direct integration. Like you and I have to go to ChatGPT or Claude or whatever,
Yeah.
and it's separate application. There is Copilot, but I'm not.
We use Copilot.
Yeah, yeah. Like, but I think that it's just kind of on the bleeding edge of integrating AI, and like you can, if you have an Android, you can use Gemini or whatever it
Yeah.
is. But the integration, I still think, is quite low as far as the applications we're so used to using and actually implementing AI. But I think that as we kind of progress and get more comfortable with it, you'll see AI pop up more and more. Just one tip, I guess, for your listeners is just prompt optimization.
Yeah.
Is like key to that.
Yep.
You can just put in optimize this prompt, and
Oh, really?
it'll optimize it.
I did not know that.
Yeah.
Because it's a lot about the prompt,
Yeah.
for sure. Let's just switch to kind of some of the interesting stuff you're doing in real estate. I believe it's, again, urgent care facilities.
Mm-hmm. Yeah.
Talk a little bit about that. And I have a few different partners in that space. It's a very interesting space, urgent care.
Yeah, so this is what I invested, personally. I began investing, before I joined the current firm I was at, and, I'm able to do it still professionally, although I devote most of my time, a substantial time to my day job. I have partners that help with the day-to-day, but what's interesting about that particular model is we actually do use a form of advanced multiple linear regression to predict patient volume in markets. And so what's interesting about our conversation on AI, people are like, oh, it can do this, it can do that. But there's certain things that AI can't do that just good old-fashioned multiple linear regression modeling can do better. And that, in this particular instance, is understanding, what the behavior will be of this particular population. And once we understand it based off of a set of variables, we can then say, all right, with confidence, we can develop an urgent care in this particular market. So I think that what's interesting about commercial real estate in general is the application and utilization of statistical modeling is pretty low. We're not even talking about AI right now. We're just talking about just modeling demand patterns.
Yeah.
It's not very advanced. And so I think if you have that competitive advantage, you can move in markets much more quickly, much more confidently. But what it allows you to do, and I think this is a broader point, is it allows you to also pass on things much more quickly, much more confidently. And there's just so much to be said for doing that efficiently. But I've been very lucky. My partner that really handles the day-to-day is just, and it's a mutual friend of ours, Alan. He is just this incredible real estate entrepreneur, very detail-oriented, very responsive. That is something that is, really valuable to me. Like I've learned that my best partners are the ones that are most responsive, both at work, the folks that I've worked with, like our legal team that we're working with right now, at work, they are incredibly responsive, and I really appreciate that. And I don't think AI is going to necessarily replace it. It may make things easier, though, as far as being more responsive and being more comprehensive to people. Also, I think if someone's lazy, though, just another tangent about using AI, they may just say, reply to this email without really reading it.
Yeah.
And then they're just giving their autonomy away to something.
Yeah.
And they're being responsive, but they're not being thoughtful.
Yeah, that's a problem. But to your point, when I think about Alan, some of the deals that he's talked about, they seem to be always very complex.
Yes.
He doesn't shy away from complexity.
He loves it.
He loves the complexity, and it just requires a lot of different moving parts and people, and for you to fly to places and build networks, which he's very good at.
Yeah.
Which, I don't think AI is going to do that.
Yeah, and I think what really drew me to my current firm, CPF, is the way they execute on their medical office strategy. Resonated so much with me was what I was already doing, but they're just doing it at a bigger scale, much more complex deals, and they're able to create so much value from that. And I really appreciate that. But again, as I mentioned earlier, having that investor mindset, I think, allows me to do my job more thoughtfully. And so, I really enjoy like seeing how they execute, especially because it's at such a large scale where, I couldn't even dream to do it myself. But,
Yeah.
I love being a part of that value creation process.
Yeah. Well, how much does CPF manage right now?
We manage about $5 billion AUM.
Okay. And do you guys talk about internally what your goals are long term in growing that?
We want to continue to grow it, but the team is very, very thoughtful about its growth. They want to remain committed to kind of the specialist operator area within private equity. If it's not, very, very operationally intensive, it's going to be less interesting for them to actually focus on it. And I think that they want to, like, for example, in the private equity side of the business, we've continued to invest in these same three verticals: value-based care, medical specialties, and technology. And we've just been able to figure out different ways of investing in each one of those verticals, but we're always within those verticals. And similarly with like medical office and senior housing, there's a lot of different ways you can invest in those sectors, but you don't have to branch out too much further in order to create a lot of value. So I think having that discipline, understanding that really well, and just kind of continue to do the same thing over and over again has been really fruitful for them.
Yeah, I mean, my experience as an advisor, an investor in these types of funds for clients is that the ones that tend to do the best are the ones that really specialize and focus on their knitting versus try to expand too much or get too big too quickly and oversaturate the market with capital. Okay, well, let's end where we started. When's the next time you're gonna make some bolognese?
Oh gosh,
Hey, can I try some?
Yes, you can. I'll save some for you. It's like it's a winter dish. And I took a recipe that like took 7 to 8 hours, not 78 hours. That would be a torturous process to about 3 hours.
That's like smoke. That's for the smokers guys.
That would be excessive. I don't love any dish that much. To about 2 to 3 hours. So it's still very time consuming.
Very time consuming.
But we do a double batch, and it's the end product is still as good as the 7 to 8 hour one.
Yeah.
So well, yes, I will save some for you.
I'm a little farther behind. I'm still trying to perfect how to hard boil an egg.
Cooks Illustrated is your go-to. You start with.
What about just AI?
You could use AI. Actually, yeah, you can just use AI.
Yeah, that's what I'll do. Well, it's nice having you on.
Yeah, likewise. Thanks, Ilya.
All right. Appreciate it.